menopause. Menopause is when a woman stops her periods after she reaches 45, beyond the 45 or 50 years of age. So if you don't bleed for 1 year, then you name yourself as a postmenopausal. So if after a year of stopping to bleed, suddenly, probably after 50 years or 60 years of age or 70 years of age, suddenly you see a bleeding, then it is called postmenopausal bleeding. So this is not right. It can be sometimes very simple issue. Sometimes, most of the time, it can be due to a cancerous change in your uterus. So the simple thing is, most of the time we see is a small tissue development called polyp, or some tissue development inside the uterus which will cause a bleeding. So those kind of time we will remove the polyp and send it for testing, and then the treatment is done. You don't have any problem at all. And we will send this tissue for histopathological testing, and if they say it is a very benign one, that is, it is non-cancerous, I don't think you need a follow-up also. But if when we do a scan itself, we can see if the tissue development is very irregular, there is a lot of blood vessels seen in the scan, the uterus looks little abnormal, then that is the time we think this postmenopausal bleeding could be due to cancer. So we do an MRI. If MRI also confirms that there is some changes in the blood flow and the thickness and the tissue development inside the uterus, then definitely if we identify in the early stage of cancer, we do a hysterectomy, remove all the ovaries, uterus, everything. But if we identify you in the later stage of the cancer, probably the treatment changes. But definitely there is a cure.